everyone, and welcome to another episode of Disruptive Dental Science Podcast, brought to you by Dental Advisor. I'm Dr. Matthew Miller, a clinical ambassador for Dental Advisor, and joining me today is my colleague, Dr. Ashton Prince, a fellow clinical ambassador. And we have on the show today a fantastic contributor and evaluator with Dental Advisor, Dr. Joy Poskozim. Dr. Joy, thanks for joining us today. Tell us a little bit about yourself and kind of your scope of practice.
So thank you for having me. I am in Chicago. My practice is in Chicago. My practice, I was fortunate to get a grant. So my practice is completely American Disability Act compliant. So I have a lot of patients that live in long-term care communities, whether it's be memory care or assisted living or skilled nursing, if they can make it into my office. We also have a family practice. Mondays and Tuesdays, I'm there. Wednesdays, Thursdays, and Fridays, I go into the local communities to different homes in order for me to provide dental care for them there.
Fantastic. That's a wonderful need, absolutely, and not enough people doing that. And we've done another podcast, Dr. Ashton Prince led that podcast recently, where we talked about your outreach and your practice and what you provide to those long-term care communities. So definitely check that out if you haven't already. So this is kind of a follow-up from that podcast, and we talked a little bit about the services you provide and just some of the limitations in the aging population and how the difficulties that we see that present. So given that this is one of our highest risk groups of individuals, whether it's for dental caries, periodontal disease, just the basics of function and daily life, right? How, what are some things that you note that are distinctively different in this population, and how do you address that compared to the general public of a younger, more at less risk group of individuals?
Absolutely. One of the first things I touched about a little bit about it in the last podcast we did together, but the first thing I'm going to be looking at is their saliva, quite honestly. I want to know if they have good quality of saliva, good quantity of saliva. And those two things are very unique in and of themselves. So, excuse me, a patient who, or one of my residents, a patient in the chair or even a resident, they may not be complaining of xerostomia, which is the subjective definition of dry mouth. Dry mouth is objective, where we're actually testing the saliva rate. So xerostomia is what the patient is feeling. And they may not, if they have a quantity of saliva, they might not be complaining of being thirsty or being dry. But I'm going to be looking at that quality then. And the quality of the saliva is going to be thick and ropey, then we need to have a conversation. We need to make sure that they are using something that is going to be beneficial to help keep the saliva flow, regardless if they have what they would consider enough of the saliva. And vice versa, if they don't have enough, then these are the ones that are usually complaining that they're constantly, wanting to reach for a Werther's or something else that they are, they want to be sucking on or drinking water, or there a lot of times I find that they're drinking coffee or tea all day. And what they don't realize, and things that we have to remind them as dentists, is that both of them are dehydrators. They actually do not help. And it doesn't matter if it's sun tea or green tea or black tea or, coffee is, hot or cold. It's irrelevant. Both of them are dehydrators in general. And so we want to make sure if they're having that, cup of joe, we want to make sure they're chasing it with a glass of water, or they're drinking them together, especially if they're on medications for chronic conditions. Because, as we know as dentists, that over 85% of all medications for chronic conditions cause dry mouth of one way, shape, or form, especially if those dosages of said medications have been raised. So that's what I'm looking for too. Also, like you said, largest growing population and still able, a lot of them, to come into our practices. One of the things we also need to know about are they on thickeners? Do they have dysphagia? Are they beginning to have a difficult time with swallowing? So if that's the case, I'm immediately going to be putting them on a Preventive or generic toothpaste. And with Medicare, it's a 90-day supply. So I make sure they get the 2 refills, and then sometimes they get all 3 at the same time. Sometimes they don't, depending on their plan. But this is the things that I'm going to be, looking for them. And then we also talk about over the counter products. For example, yes, Biotene and Lactide, they split. Lactide has actually the salivary enzymes. whereas the Biotene does not anymore. But I do say to my patients and the families, Biotene is swallowable. So for our patients that really are having a very difficult time, we're leaning them back, or we can't lean them back that far anymore because they're gurgling, that suction is just not enough. They're really afraid. They're really protecting their airway because they're beginning to have a difficult time spitting or swallowing, controlling the water content in their mouths. Then I am going to be recommending the Biotene, whether it be the mouthwash, the toothpaste. Amazon, they do sell it in the pack where it's the toothpaste, the mouthwash, and the gel all combined. And of course, you can get on the subscription service and get it, as often as you want it. And I use the Biotene gel for my lips in this dead of winter. I'm in Chicago this dead of winter. I am using that gel. It's in my car. I love it because it's an immediate effect. You see immediate change in those lips. And of course, we want to prevent something like angular colitis with collapsed lips, right? We want to be able to prevent that. So I'm not a big fan of the other over-the-counter, Carmex's, I hate to say the name and not give it a good rating, but at the same time, I want to be using something that I know is going to work, that actually can get absorbed instead of just coating the lips. Big fan of that Biotene. I'm also a big fan of the Act Dry Mouth mouthwash. It's got fluoride in it for the ones that can still spit, rinse and spit. Then I'm a big fan of that one. And I see a lot of good use with that. Ones that that patients have told me they really haven't liked the flavor of is TheraBreath is the one where they have a dry mouth product as well. Some of my patients haven't been very happy with the taste of that particular dry mouth one. So I mention it. I say it's out there. And I know Closest has one, the Closest Silver. Also is great for dry mouth. There's also, you can do Stella Life, where that is a decent product as well that has been shown to be very helpful with dry mouth. But my go-to, and the one that I found that most of my patients have been using, and I see with really good results, they're meaning no cavities, is the Act Dry Mouth mouthwash. Personal opinion. They don't know me from Adam, but there you go.
I'm right there with you.
And so I'm really, working on, making sure that they're using some kind of product beyond just brushing their teeth. That's important to me.
Biogel, Biotene
Go
gel
ahead,
is the Aquaphor 2.0 on your lips, is basically what you're telling me right now. Because that's
Oh,
my wife
absolutely.
uses all the time. So now I know if I don't have any Aquaphor, I'll just throw a little Biotene gel at her.
Yeah. Oh, that stuff's amazing. And and when I'll have some for them, right? So I buy it, and then I have them put it on their lips, and they're like, the look on their faces, they're thrilled. And when I have an older person in my chair, whoever brought them, and I really want to know in advance if this person has control or not, but that's for another time. But I will have their daughter or even the driver in there with them, so that I don't want anyone to forget what we've done for them. And so therefore, I'm doing this for them, and now the daughter is on Amazon trying to find that product for them so they can order it right away.
You see that all the time, don't you? That they're actually taking notes and say, okay,
so
literally, what was that you needed? So I need to get that for. So
they will come to they will come to my monitor, because I'll pull it up in the monitor, and they'll take a picture of my monitor, in my operatory, so that they can order it for them, before they even get home.
I love it.
Yeah.
Do you find, because there's such a difference in saliva quality, right? And whether it's medication-induced dry mouth or salivary dysfunction, what would you say you tend to do saliva replacement therapy versus salivary stimulants, or not necessarily a systemic medication, because those have their own side effects, but something that's like Xylamelts or something like that they can tuck in under their mucosa, under their lip. What are your thoughts on, or how do you differentiate when you're going to go from a replacement versus a stimulant?
That is a great question, and I am going to be first and foremost very pro dry mouth lozenges. Huge fan. Why? Because what is it doing? You're absolutely right. It's stimulating the saliva. For their at-home care, I'm going to be recommending that they use that dry mouth mouthwash immediately after they brush their teeth, right? Or if possible, then they'll do maybe a rinse and spit of it before they eat, if they're beginning to have problems with dysphagia. But yes, I am all about the Act dry mouth lozenges. Biotene also has one. And also, I don't know if you guys have heard of this product, Dr. John's Healthy Sweets. The dentist, Michigan, retired, great guy, daughter, type 1 diabetic, felt bad for her. She couldn't eat what all her friends were eating, her sisters were eating. So he created this company, and I am just in love with him. He's a sweet, sweet man who's retired now, but he created these amazing products. And the first thing that he created was her favorite candy, which were lollipops at the time, because she was like
Aw.
3.5, as the story goes.
Nice.
So I don't want to say, stop the Werthers, but I kind of do want to say stop the Werthers.
Sure.
But instead, I want you to try this product instead. I want you to try, the Dr. John's. They're comparable in price. They're no more expensive. Yeah, you have to go to their website and buy it. Big deal. That's what we do these days, right? We buy stuff online. So getting their multi-pack, their variety pack of the lollipops, they have xylitol in them, or you can even get the ones without xylitol for those with IBS or Crohn's disease that have tummy upset. But wonderful products, big fan, have a wonderful result from patient feedback and family feedback on those products. So yes, and the Xyla melts are great. I have some patients though, especially if they're older, they get a little nervous having anything like, because the way it's described in the pack is to have it like, on the inside of the palate. But that's where it can really stick. I will mention that because as the day ends, we have less saliva in our mouths, easier for that to stick in the mouth. So yes, if for a long term, especially overnight, big fan. But I also do recommend then to have the Biotine as well. Biotine is swallowable. They can have that on their bedside table as well. And then and I tell them this, I'll be perfectly frank with them. And then you don't have to pee 20 minutes later because it's getting absorbed in their mouth and it's coating the back of their throat. Hopefully they're able to sleep longer with it, especially with those with CPAP machines. Huge fan.
Well, that's a really good point, especially for someone who's maybe not mobile, right? So getting up to go to the bathroom could be a chore.
Huge fall risk
for their caregiver and things like that. So that's actually quite a notable insight, I feel like. So for people who are maybe you're in palliative care stages, or they're perfectly healthy and they're coming into your regular general practice and they're not disabled, they're not late stage life, but maybe they're at a high risk of decay, or maybe you just happen to find a cavity on them. But certainly people with dry mouth, whatever the cause, they're going to be a major risk for decay in hard to reach areas, right? What are some of your techniques and philosophies? I know, I think we probably overlap on a lot of that with the fluoride and SDF and things of that nature. And what's kind of, what's in your toolbox, if you will, when a patient presents to the clinic like that?
Great question. So I always have Riva Aqua, and I always have, I really like the Centrix Silver Sense SDF. Those are my two go-tos. Yes, I originated with the Elevate. And I will say, and they have the gel now too, which is absolutely fantastic. And so I'll put that gel in between teeth. If I, on X-ray, if I'm beginning to see something, or I will even do it for really old silver fillings that are MOs, DOs. And these are patients. Now you have to understand that, they are in memory care. I can get them to open their mouth. Am I going to be able to get an X-ray? I'm not going to lie to you, probably not. So I'm going to be proactive, as we are as dentists. I'm going to be proactive. I want to prevent. And so I will put in that Elevate gel in between the teeth to prevent. And yes, I will see the teeth darkening. So I've known I've done the right thing. Now, of course, for my residents, I'm going to be asking permission first from the families if this is something I can do. And so then I educate them with whatever product I choose to use. I will then send them a link explaining, the how, where, and why I'm going to be using it. So I will use the Elevate gel in between the teeth specifically for those. Well, and they have crowns too. Then I'll put it in between people that have crowns on teeth. I really want to make sure that there's nothing there that can be a problem for them in the future. I always want to make sure that they have, their teeth. And this is a wonderful palliative, especially for those in hospice too. They're all about, palliative care. Fantastic. This is palliative, right? This is not invasive. So I really like the gel for interproximal. Obviously for the Riva Aqua, I really like it for those with high lip lines. The older population, they generally speaking have more of a collapsed bite. That being said, when they smile, I really don't want them to see, that darker tooth. More importantly, I don't want the family to necessarily see that. So I use the Riva Aqua a lot, especially for those that I have the time where I can do the two-step. That is huge. And the reason why I like the Silver Sense is because I don't see, and this is once again anecdotal. I saw with the Elevate, and I always would warn my patients, regardless if they're in my chair or in a wheelchair, that this may sting a little bit. I really try to keep away, the gum, but I would see, especially for the class fives, that the gum tissue would get a little annoyed. And I didn't like that. And, sometimes they would feel a sting, sometimes they wouldn't. It would depend. I don't have that with the Silver Sense. Once again, that's anecdotal, personal opinion.
Sure.
But I really do like the Silver Sense a lot. It is blue, so you can see it while it's being applied. And then obviously I'm throwing fluoride on top of it. Once again, Centrix doesn't know me from Adam, but I like the Centrix fluoride, especially for adults. Why? There's a lot in there. And so for an adult dentition, I really like using that particular product just because there's a lot of it. And yes, there are some wonderful products out there like MI Paste, absolutely fantastic. When I'm going to be applying something directly onto the mouth, this is what I'm using.
Yeah, that's fantastic. I think, you touched on so many things there that I think a lot of people should probably go back and re-listen to all of it, because there's a lot of great information. And you say the why, because every time I wanted to follow up, well, why? Tell me why. Yeah, you gave us that. That was awesome. Agreed. I started with an Elevate. I keep two SDFs in office, the Riva Aqua and the Centrix SDF. Those are my two go-tos for the exact reasons you kind of talked about. And even in a non-geriatric population, I find that those can be very helpful in prevention, sensitivity, but certainly in restorative if you're doing selective caries removal and you're wanting to do remineralization and bioactivity. So in the times that you can work on a patient and they're not going to resist you, I think you have a lot of insight from your other experiences to provide the general population as well. Especially if following that up with
but to follow up with that, I mean, it's the work that I've done in the long-term care communities that I'm like, well, gosh, if I can do it for them, let me, extrapolate. Let me do this for my other patient. Let's see if it's going to work as well for them. And for those that are very denophobic, I had a 32-year-old in the chair on Monday who was incredibly denophobic. I'm really worried about certain areas because she used to use a medium toothbrush for years and years and years and years. And we finally got her off of that, but I'm a little worried. Yeah, I applied the Riva Star for those areas because she began to feel sensitivity. And I'm like, you know what, this is what I'm going to do for you. And I'm planning on doing a follow-up phone call on Monday. But this is something that I can now use, that I feel very comfortable with using for any age of the population for the different purposes that these products are meant to be used for.
Fantastic. Could you touch on something that you have really been passionate about and really do for all your patients? And that's, we do all these assessments, right? But I think at the crux of what ultimately causes a lot of dysfunction and disease and whether it's decay or periodontal disease and just overall breakdown is dry mouth. You have, a dry mouth assessment tool that you use and a checklist, if you will, and similarly to a caries risk assessment. And then based off that, how do you modify your patient's care, whether it's frequency of visits and how you scope their therapy? Could you tell us a little bit about that?
Absolutely. So for those that are, let's say, for example, if they are going through cancer treatment, right? So now that is a very acute situation. But the quality of the saliva and the quantity of the saliva can be radically changed permanently, whether it be head and neck or, another part of the body. Yes, the treatments are a lot more focused now, but that doesn't necessarily mean that doesn't affect the salivary glands in general. So for those particular patients, I want to make sure that in advance, we are starting something before they even start treatment. So it's really important to make sure that we are ourselves as dentists or our hygienists really are reviewing medical histories and making sure that we know what types of treatment they're going to be having in the future, what kind of diagnoses they have, because it really does affect our treatment planning, as well as the products that we recommend. And I recommend products all the time. I think that's crucial for our work that we do. And I want things that are accessible for them. I want things that are going to be easy to find and that are readily available. And for those that do shop on Amazon, like I said, we can say what we want about it, but it really does serve a huge purpose for those that do not leave the house very often, or don't want to, just for whatever reasons. They can just order it. It's just easier. Families, they're in the sandwich generation, right? They've got kids, they're taking care of an older one. This is just easier. So when it comes to for a treatment like that, then I'm definitely going to want to start ahead of time. And I really do like the Stella Life product for that. And I really want to make sure that they're using something twice a day. As for other products that I recommend, I want to make sure that they're, first and foremost, they're drinking water. And once again, this is anecdotal, but I want them drinking flat water. Over time, with the carbonation, of the other waters that are available, that are so readily available now, carbonic acid, it's a weak acid, it's still an acid. And when I explain what carbonation is and it's carbonic acid, like the eyes pop out of their heads, they have no idea. So over time, we're going to be getting, with the White Claws in the world, and the different flavors of White Claws, as they continue, we're going to see an increase of sensitivity. So I recommend everyone definitely buy stock in Sensodyne for sure, right?
Because this is something that we're all going to have a
problem with. They
don't want to hear, oh, I can't drink that anymore. Dr. Joy said I can't drink that anymore. I don't want to hear that. Give me the stuff I still enjoy.
And for this situation, I don't have anything to replace it. So
fair.
It's on them.
I mean,
but these are their concern, their problem, that we have to understand that this can definitely be a problem in the future, and their enamel thins and now their smiles aren't as nice as they were. Yeah. This could be a problem, and my patient should be forewarned. Our patients should be forewarned about that. But yeah, so what other products that I know that I'm recommending? I'm definitely recommending the the products that I really like are the ones, like the ACT, the ones that are just readily accessible. When it comes to, if they're dealing with a dry mouth situation, I really want to know what they're using now. I want to know what they're doing themselves to help control it. And if they're not doing anything to control it, or if they're sucking on lemon drops or something like that, I definitely want to make sure that I'm substituting that with something else. So first and foremost, I want to know what they're using.
You take the good from what they're doing, and you're just adding to it so that you can reemphasize, you guys are doing great, but you could get a little bit better if you do this and this and this and this.
Yes. And also too, like a patient who has been on on a medication or hasn't been on a medication before. So let's say they have now been diagnosed with diabetes and now they're on metformin, for example. Okay, great. You may have this problem. Let's be preemptive about it. I want you to start using a dry mouth. Oh, doc, I don't have that problem. Yeah, have it anyway. Start using it anyway, because there is a really strong chance that you're going to start getting dry mouth, and it's going to be so subtle, you're not even going to notice the difference. And you're doing a great job with your brushing, but in 6 months, I might be finding new areas of decay that you've never had before, because without even you realizing it, the quality of your saliva or the quantity of saliva, I'm not a fortune teller, I can't tell which one, but I promise you it's going to be one or the other that you're going to have a problem with, and that we really need to make sure we focus on that and keep your mouth as healthy as possible before that problem arises. I don't ever want that problem to arise. Another thing that I recommend too is the alkaline waters. The 9.5s, right? Essentia was the first one, and now, a lot of them have it. And, there's been a lot of like, oh, well, that's going to affect the tummy. No, it's not going to affect the tummy. It gets absorbed and the pH changes pretty much back to neutral as soon as it hits the gut, right? What was the term? Pyloric sphincter? By the time it actually reaches the stomach. So we want to make sure that our mouths are basic, right? As basic or neutral, as basic as possible, especially if we're trying to counteract our normal daily, what we're consuming on a daily basis, right? We want to make sure that we're counteracting those things that we're eating or drinking. So by drinking the alkaline water, I'm a big fan of. It's helped me. I know I show them my Essentia bottle. That's what I drink. It's what I'm used to. It's what I buy. But I'm opening their eyes that there actually is a purpose. There's a reason why these products are out there, and there's something that you might want to try as well. And so, I recommend the alkaline water as well, especially for my soda drinkers. I'm like, okay, well, can you chase it with one of these waters so that your mouth isn't so acidic? So I'm not going to be seeing a wear, your fillings wear faster, or you're beginning to get sensitivity now because of what you're consuming on a daily basis for the last, I don't know, 10, 20, 30 years.
At least.
So, yeah. So, there's so much floating out there, and there's a lot, kind of caught up in marketing from the manufacturers and
Yes.
things like that. And, one of the things, obviously I'm very biased and passionate about the dental advisor, but one of the things we really try to do is to be unbiased. And that's exactly,
Yes.
we're biased about being unbiased, right? And, there's a lot of great information on our website for those of you who want to look up some of these products we've talked about. You can request samples of that so you can try it in your own hands. But Dr. Joy, when you joined on, like, were there any things that you got introduced to from the dental advisor? And then secondarily, where do you go to find your research for some of these products that are readily available over the counter and things like that? What's a good resource besides
those
us?
Yeah, no. Great question. So I'm also a big fan of being as much as possible BPA compliant. And it was through dental advisors that I discovered that Voco is one of the products that tries to be that way, as well as Venus. And so with the different Venus products, I love, as well as the Voco products. And for my patients that are concerned about that, I don't have many. But then again, it's not really something I promote on my website, and it's probably something I should start doing. But I do believe that, we want to be as healthy as possible. We're choosing the safest products as possible for our patients. I also do explain to my patients that not all tooth colored fillings are the same, that I use different products for different reasons. And I will show them, I will actually put some on their finger and show them, how this material works. I want to include them in their care. I want them to understand what we're using. Yeah, it takes a little bit more time, but let me tell you, it's worth it. And because now I get the fiance or the husband, or who hasn't seen the dentist in forever, because I've gained their attention, I've gained their interest, but more importantly, I'm engaging with them. So through Dental Advisor, learning about Voco and learning about the BPA products was very important for me, and I thoroughly enjoyed that. And I also learned about other products, like it's not just a Nomad anymore that will that is freehand taking X-rays. We now have the X4 is a possible product that you can use. So wonderful guidance in that. So I do go to Dental Advisor a lot in looking at what other products are out there, what the opinions are. As it goes to the over-the-counter products, I have to be honest with you, it's really, for me, more anecdotal and what patients are telling me, how they're feeling about the product. It's unfortunate when it comes to over-the-counter products, there really isn't a whole lot of research where they're actually very specific on what product they're using when it comes to research. And Google Scholar and I are like this, but it really comes down to, they can tell me, that these over-the-counter products will work, but having been a dentist for 25 years, almost 26 years, I really value what I've seen, just, once again, to use the term anecdotally, what my patients want to use, what they're going to use, and what they're going to use on a regular basis to have that, overall good oral health. So, I could read that a product is wonderful, like TheraBreath, for example. It's a wonderful product. It's been around for a long time. There's a lot of different options with them, but if they don't like the taste of it, guess what? They're not going to use it.
Sure.
So I'm not going to promote one particular product over another. I'm going to say which one is my go-to, and then I'll give them other choices, and then they can make that decision. And the bottom line that I say, if you remember nothing else from this conversation, just be consistent with it. Just don't have it, collecting dust on your, by your sink. Make sure that you're using this twice a day, every day. Rinse, spit, walk away. Do not rinse with water afterwards. Let those wonderful products work in your mouth, and then don't consume anything for at least 5 minutes. The literature says 20. I get a roll of the eyes, and I'm like, but I give it 5. So if you can give it 5 minutes, so let that stuff actually kick in and do its job for both the soft and hard tissues in the mouth.
Now, the thing that I love about all of this is the ability for you, Joy, to give options to people. You meet them where they actually are, the things that work for them, as opposed to having this blanket, this is the material that I use, which means it has to work for you, which is not always the case, as we all know. But to say, this is what you enjoy, this is what you do, this is what has worked. Let's just add upon that. Let's just make it that much better for you so that we can get the best health. You even say on your website that the best oral health goes to the best overall health, which is absolutely accurate. And we all know that as well, which is, let's be honest. I love you, Joy. I mean, for crying out loud, it's in the name. It's the joy to even talk with you about this kind of stuff.
Thank you.
Yeah. Lastly, thank you for being here. And what I want to last question I want to go out on is for people who are inspired by you and inspired by this podcast, or anybody else, just out there who has a passion for treating the geriatric population or at-risk population and doing these house visits or these long-term care facility visits, how would you, or where would you direct them to kind of find out more information and to kind of get started?
Reach out to me, email me.
Done.
jvpdent@gmail.com. Please. We all can help each other with this. I don't, expect anyone to become a house call dentist. It's backbreaking work. And I'll be honest with you, it's not very lucrative, but it's very, very, very rewarding. And it may not be lucrative for the actual patient, but let me tell you, I can't tell you how many nurses, caregivers, and their families I've gotten as patients because of the way I've treated their residents. Wow. That's been really huge. So email me. Also, you can also go to Special Care Dentistry Association. I think it's scdaonline.org. If you need to find a dentist, if you want to have resources for yourself in your neck of the woods of dentists that do what we do, then Special Care Dentistry Association, you can go by state, you can go by city, and then they will have a list, hopefully, of every time I've done it, I've always had a list. I've always had more than one person to choose from. And some of them I actually knew, to say that these are people that will, go into a home or go into a long-term care community, because I just go into long-term care communities. I also go into people's homes. And there's different types. There's me, I'm a house call dentist. I will actually walk into said home. And then there are the mobile dentists. They're different. They're the ones that I have the mobile van. And then the resident will have to go into said van. Now, in that situation, I don't know if you've ever seen them at the dental conventions. They're flipping amazing. Yeah. You can have ideally 2 chairs where you have all the bells and whistles. You can do everything from a full mouth series of x-rays. Some even have Panorex machines. They're doing root canals, they're doing implants. Amazing. I am not that dentist. You do not want me driving a van of any type, let alone holding hundreds of thousands of dollars worth of material. No, not me. But I will be the one carrying the bags, going into someone's home, being at their bedside, being, kneeling down, being next to their wheelchair to help them out. So reach out to me. You can also find me on LinkedIn under my name or under my website, or under my website, Joyful Dental Care, the name of my office. Or you can also, reach out to me by email, any way, shape, or form, and I would be more than happy to help.
Give your email one more time.
You got it. It's my initials, jvpdent@gmail.com.
Beautiful.
Thank you so much. And thank you for putting yourself or making yourself available and putting yourself out to help others in your position. So, well, that's it. Thanks so much, Dr. Prince, for co-hosting this with me and joining me on this podcast. And Dr.
Joy had to.
She was the star of the show. I mean,
I flubbed though. I feel so bad.
No, you were great. This was really helpful. I learned a lot, and I know our listeners will too. For more information on some of the stuff we talked about, and to listen to this podcast and others like it, go to www.dentaladvisor.com to find out more information. Again, as always, thanks for being here, and we appreciate your continued support.